Welcome back to Fox 51. Today, Dr. Guy Danielson from Texas Spine and Joint Hospital is here to talk about lower back pain. Good morning.
Morning. Good morning. How y'all doing?
Good. Thank you so much for joining us. So this is obviously a problem for many people out there having lower back pain. So I know you brought some tips and tricks and all kinds of things to help people out.
I have all kinds of ideas.
That's awesome.
So basically what I want to say, just to kind of get started, is I have three things to mention to patients, potential patients, that they should not do, sort of like, what's a bad idea? Well, taking narcotics is a bad idea, going to bed is a bad idea, and rushing in and getting an MRI right off the bat, that's not a very good idea either. So the next question is, well, what's a good idea?
Right, exactly. You gave us the bad, what's the good now?
So the good news is, we've been developing in our little conversations over the last several weeks the concept of advice to patients about information that they can use to be their own doctor, to make their own decisions. Because if you don't, we don't live in a medical environment where you could just automatically know where to go. So if you're going to be your own doctor, then you need information. And every week I've given little tips about something I thought might be a good place to start, but I usually leave it up to everybody else to decide really how to get it. But this time, since I am a back surgeon and I know a lot about it, I have a video that I recommend to my patients, and I really think it is beyond awesome. So.
What is that?
Oh,
what is the video? We
thank you for asking.
You're welcome.
It's a video that is on YouTube. It's 11 minutes and 5 seconds long, and it's done by a doctor who's a family practitioner. His name is Dr. Mike Evans. And so I'm mentioning that, YouTube, Mike Evans, back pain. If you know those things, you can Google it and you can find this video. And it is brilliant in the fact that it talks about all the things that a patient needs to know, that if I had 11 minutes and 5 seconds, I couldn't possibly do it, because it's really lays it all out. And one of the things in the video that he says towards the end is, what is the best way to find the right people to take care of you? And he says that the medical literature supports the fact of having a multidisciplinary team of doctors. And guess what? We have one. And that is, I actually started this over 25 years ago, and I was watching TV and I saw Joe Montana come back to play football after 6 weeks after he had surgery, and I went, good grief, how did that happen?
How did he do that? Yeah, exactly.
And I went to California and met the doctor that did it, and I discovered it wasn't just the surgeon that did it. He had a whole team of people. So we came back, we started this team. We've had it for 25 years now. It's at Texas Spine and Joint Hospital.
Yes, and moving back to low back pain, what are some things that, what are some red flags people might see or they need to look out for as far as that?
Well, they're very rare, but when they occur, you've got to get to a doctor or make sure you find somebody that knows. One of them is severe pain in the legs, and if you have numbness around your pelvic girdle or in your groins, those can mean that you've got a real dangerous amount of pressure on the spinal cord, and so something needs to be done right away. That's when you call. That's when you call you guys. Right. And so if people are wanting to, find more information, or maybe they have one of those red flags, can you give us some contact information for you guys, or maybe a website? The website is guydanielson.com, and the telephone number is 903-530-9063. And the group that I'm with is Precision Spine Care at Texas Spine and Joint Hospital here in Tyler. Okay, awesome. Well, thank you so much for coming on our show. We appreciate it. Thank you for having me. No problem.